Why is underlying OCD often missed in eating disorder recovery? Imagine trying to solve a puzzle where some pieces look like they belong but actually don't fit. That's what it can feel like when doctors try to understand eating disorders and obsessive-compulsive disorder at the same time. Both conditions share many behaviors and thoughts, which makes telling them apart tricky. When someone has an eating disorder like anorexia or bulimia, they often obsess about their body shape, weight, and food. They might follow strict rules about what to eat, measure everything, or arrange food in specific ways. These behaviors look very similar to obsessive-compulsive disorder compulsions, like checking repeatedly or performing rituals to reduce anxiety. Because these actions serve the goal of controlling weight or appearance, they are often seen as part of the eating disorder, not a separate issue. Another reason underlying obsessive-compulsive disorder can be missed is how people see their behaviors. Those with obsessive-compulsive disorder usually realize their thoughts and actions are irrational. They often feel driven to act because of anxiety or fear. But people with eating disorders often see their restrictive eating or rituals as part of who they are or as necessary. They might believe these behaviors help them stay safe or in control. This difference in insight makes it harder for clinicians to notice obsessive-compulsive disorder symptoms during treatment. If someone is more focused on losing weight or controlling food, they might not mention or even recognize their compulsions as separate from their eating disorder. Starvation and malnutrition also play a role. When someone is severely undernourished, their brain can behave differently. Some obsessive-compulsive behaviors may appear or worsen during times of malnutrition. As nutritional health improves, these behaviors might lessen, leading doctors to think they were just part of the eating disorder. This can hide the fact that there is a separate obsessive-compulsive disorder underlying the behaviors. Treatment often focuses on restoring weight and stabilizing eating habits first. This can temporarily reduce obsessive-compulsive disorder symptoms or make them less obvious. Without specific assessments that look for compulsions unrelated to food or body image, clinicians might miss the underlying obsessive-compulsive disorder altogether. To truly help someone recover, it's important to do thorough screening for obsessive-compulsive disorder symptoms beyond just eating habits. Combining treatments like exposure and response prevention, which is effective for obsessive-compulsive disorder, with eating disorder therapy can lead to better long-term results. Recognizing that obsessive-compulsive disorder can hide behind eating disorder behaviors is key. Addressing both conditions together helps ensure a more complete recovery and reduces the chance of relapse.